My name is Brian Gary. I'm a general surgeon here at Jackson Hospital and Clinic. My specialty includes minimally invasive surgery, robotics, endocrine, GI, trauma when I'm on call, as well as pediatrics. So I say pretty much everything from the neck down. If it's not something I do, I'll get my patient where they need to go. Bariatrics, my experience with bariatric surgery date back to my time at Medical University of South Carolina in Charleston, South Carolina. It was there that we had a very successful and busy bariatric surgery practice. We worked under several attendings that were with the Board of Bariatric Surgery, and so it was part of our general surgery training. At that time, gastric bypass was the most prevalent surgery being offered, and so we got a lot of experience with laparoscopic gastric bypasses. As it relates to the gastric sleeve, this is something that is now becoming or has become the most common surgery in bariatric surgery, and it's something that we wanted to bring here to Montgomery and this community because it does offer the benefits of weight loss, somewhat comparable to gastric bypass with a lot less complications. Some of the reasons that patients should consider weight loss surgery would include if they've already attempted to achieve a certain level of weight loss to get them closer to their ideal body weight. Obesity has just become epidemic almost in this country, especially here in the South and in Alabama. And there's so many illnesses related to obesity, such as hypertension, diabetes, arthritis, obstructive sleep apnea, and a number of others. And so those patients that want to take control of their health, that want to take control of their life, have already really tried to lose weight on their own or with assistance, should consider bariatric surgery as an alternative or an option to help them achieve their goals. The main types of bariatric surgery being offered today include the vertical sleeve gastrectomy, the gastric bypass, as well as the gastric banding. What's become more prevalent in today's time is actually the vertical sleeve gastrectomy. We offer that here at this program at Jackson Hospital, and only that procedure because we feel that the benefits outweigh the risk. It's a situation where patients can achieve a comparable weight loss to the gastric bypass and not have to deal with the perioperative complications or even the complications going down the road. So as part of your workup for bariatric surgery, we inspect and work with our primary care physicians in treating the patients and making sure that hypertension, diabetes, cardiac disease, and all of these comorbidities that are related to obesity are well controlled. We want our patients to be good surgical candidates, and so we make a diligent effort to make sure that we don't take patients to the operating room that have uncontrolled diseases. The typical timeline associated with starting this program and proceeding to surgery is about 7 to 9 months. Most insurances require that patients go through a physician-sponsored weight loss program, and so they have to be followed for at least 6 to 7 months. Also during this time, you'll be seen by a psych evaluation, you'll see a nutritionist and a dietitian, as well as get clearance from cardio and pulmonary doctors. This procedure has and is covered by most insurances. Patients would have to check with their own insurance carrier to see if they do cover this procedure, but insurance companies have kind of figured out that the chronicity of diseases that go along with obesity are for a lifetime. And so if they can help their patients to lose the weight and come off of some of these medications for these chronic morbidities, then in the long run it's better for everyone. So in preparation for the bariatric surgery here at this program, through the hospital we offer resources that include dietitians, nutritionists, so that they can meet with the patients ahead of time and kind of go through proper dieting in preparation for weight loss. During and throughout the surgery, we have dedicated staff and nurses trained in bariatric and educated to be able to take care of the patients throughout this process. And afterwards, they follow with us for at least a year, as well as join a support group so they can talk to others that have gone through the similar process. Here at Jackson in our bariatric center, we'd be happy to work with any patient that is very serious about wanting to make a difference to their health and taking control of their life. If they'd like to come in and sit down and have a realistic conversation about their goals and what options are there for them, I'd be happy to do that with them. My name is Brian Gary. I'm a general surgeon here at Jackson Clinic in Montgomery, Alabama.